Imagine for a moment that you are sitting in your doctor's office. You feel fine, you have no symptoms, but your doctor is looking at a screen that isn't showing a snapshot of your current vital signs. It's showing a forecast. It's a prediction of your health over the next decade. For most of human history, medicine has been reactive. It has been an art of responding to emergencies and treating diseases after they appear. We have waited for the check engine light to come on before we opened the hood. But what if we could change that? Today, we are standing at the precipice of a fundamental shift. We are moving from a reactive system of sick care to a proactive system of health care. And the engine driving this shift is artificial intelligence. In the next 5 minutes, we are going to explore how AI is moving beyond diagnosing current illnesses to predicting future personal health risks, and what that means for how we live, age, and thrive. To understand how AI predicts health risks, we have to first understand the data revolution. Historically, medical guidelines were based on population averages. If you were a 55-year-old male with a certain cholesterol level, your risk was calculated based on what happened to most 55-year-old males. AI does not care about averages. It cares about you. AI systems are capable of ingesting massive amounts of data that the human brain, or even a traditional spreadsheet, cannot process. We are talking about your genomic sequence, your microbiome composition, your sleep patterns captured by your smartwatch, your daily activity levels, and even your speech patterns. Some AIs are even analyzing your retina scans for minute changes invisible to the human eye. Through a technique called machine learning, these systems don't just look for correlations, they look for complex, non-linear relationships. They find the subtle interplay between your genetics and your lifestyle. They detect patterns that are too small for a human doctor to see in a 15-minute consultation. This is not about telling you that you have a 10% risk of heart disease because of your BMI. This is about telling you that, based on the specific electrical rhythms of your heart and the specific proteins in your blood, your personal risk profile suggests a specific timeline for intervention. Where AI is truly revolutionizing the field is in the realm of chronic diseases, specifically cardiovascular disease, diabetes, and neurodegenerative conditions like Alzheimer's. Let's take diabetes. AI models can analyze continuous glucose monitor data and eating habits to predict blood sugar spikes before they happen. They learn your body's unique response to specific foods. By predicting this in real time, the AI can suggest an adjustment to your meal, or suggest a short walk to mitigate the spike. Over time, this predictive capability reduces your risk of developing type 2 diabetes entirely. But the most mind-bending advancements are in cardiology. We now have AI systems that can analyze an electrocardiogram, a heart tracing, and identify signs of atrial fibrillation or heart failure risk years before symptoms appear. The AI is detecting microscopic irregularities in the heartbeat that suggest the heart muscle is struggling, even while you are resting comfortably. And perhaps most importantly, AI is predicting the risk of adverse drug reactions. By analyzing your genetic makeup, AI can tell you if a standard medication, like a blood thinner or a statin, might have severe side effects for you specifically. It predicts the risk of the cure as much as the risk of the disease. However, let's pause for a reality check. While this sounds like science fiction, it is real, but it is not yet perfect. There are significant challenges. First, there is the issue of data bias. AI learns from historical data. If that historical data is primarily collected from a specific demographic, say Caucasian males, the AI will be more accurate for that demographic and less accurate for women or people of color. If we are not careful, we risk creating a system of predictive medicine that widens health disparities rather than closing them. Second, there is the problem of actionability. Imagine you are told you have a 30% risk of developing Alzheimer's disease in the next 10 years. What do you do with that information? Today, the treatments for Alzheimer's are limited. Predictive power without a treatment plan creates anxiety, not health. The medical community must ensure that AI prediction is tied to clear, scientifically proven interventions. Third, we have the question of data privacy. Your health data is the most sensitive data you possess. If an insurance company or an employer gets access to your predictive health profile, that forecast could be used against you. We need robust legislation to ensure that this predictive data is used for your benefit, not to your detriment. So, what is the future? It is not a future where a computer replaces your doctor. In fact, AI is terrible at empathy. It cannot understand your anxiety, your family dynamics, or your values. It cannot hold your hand. The future is a partnership. The AI will act as a digital assistant to the physician, processing the gigabytes of data to generate a list of specific questions and risk warnings. This frees the doctor to do what humans do best: communicate, counsel, and treat the person, not just the disease. When we use AI to predict personal health risks, we are not just trying to add years to your life, we are trying to add life to your years. We are moving towards a world where the patient is no longer a passive recipient of care, but an active partner in their own health, empowered by knowledge. The goal is simple: to know you so well that we can catch the whisper of a disease before it becomes a scream. Thank you.